So our project was designing an implant for the correction of hammertoes. The current need for this correction device is the 7 million people are currently affected by hammertoes, and it's most common in people over the age of 55, or women over the age of 55. The hammertoes is a forefoot deformity that is caused by a musculature imbalance that leads to the curling of the toe, as can be seen in the picture on the left, and causes a lot of pain and callus formation. This is a $1 billion per year industry, and there are about 550,000 procedures performed annually. 17% of people who've had the procedure complain about the results of their procedure. The current gold standard for the treatment of hammertoes is Kirschner wires, which is an implant that's put in through the arthrodesis of the PIP joint, which is the removal of the section of the bone on both sides of the PIP joint. And then the wire is inserted through the end of the toe to fix the bones. The limitations of this implant are it's percutaneous, so it can cause infection. It can break or loosen. It has a long recovery time, and recurrence is common, which can be seen in the picture on the right.
So our approach to this problem is to create a one-piece titanium implant to fuse the phalangeal joint, and we're going to start with using a Ti6Al4 vanadium alloy, and then fabricate that using selective laser sintering to produce 200 to 400 nanometer pores on the surface to help best promote osteocyte growth. In addition to that, we're going to include protrusions in 2 different planes on the joint to help reduce rotation of the implant within the joint. And on those wings, on those protrusions, we are going to include several ridges and holes to further increase its surface area. On top of the entire implant, we are going to coat it with hydroxyapatite to stimulate the activity of osteoblasts, promoting bone growth. And then finally, the implant is going to be inserted using the PIP arthrodesis procedure, which, as mentioned earlier, is a common surgical procedure and will require minimal changes on the part of the surgeon.
So there are many benefits for our device. Because it has so many protrusions and is coated in something that's bioactive, it will promote better bone anchorage and better bone growth, promoting this fusion, which will allow for a better recovery time and less post-operative pain than K-wires, which many patients report is very painful. And since it's not percutaneous, there is less complications that K-wires face, such as infection. This implant would be more expensive than K-wires, but this would be made up for in the shorter recovery time and less need for additional surgery. And also, this is an implant that would stay in the patient for the lifetime of the patient, rather than K-wires, which can be removed.
So some of the competition in this field are the K-wires, which are the current gold standard for the hammertoe fixation. These are low cost, familiar to surgeons, and most commonly used, but they do have the risk of percutaneous infection, extended patient discomfort, recurrence of the hammertoe problem, and they do have multiple surgical sites. There are also other types of titanium implants, as seen on the right. Most of these are 2-piece implants and are inserted with K-wires with a similar process as the K-wire insertion, but some of the problems associated with these are loosening of the joint, rotation, and movement of the joint after fixation. Finally, they have shape memory implants, which are made from nitinol, but these have limited sizes and cannot be applied for every patient. Also, they have to be frozen before the surgery, and after they are implanted and the temperature change has taken place, the orientation and the shape of these implants can't be changed, which can cause problems with the fixation. Are there any questions?